Jumper's knee or runner's knee? If you are confused between those two or want to know which one do you guys have, then stick around. This video is for you guys. Hey, how's it going? This is Saman here from All Things PT, and in this video I'm going to talk to you about PFPS, Patellofemoral pain syndrome, also known as runner's knee, and compare that with jumper's knee, which is also known as patellar tendinopathy. Before we talk about the differences between those two conditions, let's talk about some commonalities first. So first of all, they are both classified under anterior knee pain. So your knee is going to hurt in the front and not on the side or on the back. Second, they are both insidious in nature, which basically means that your pain starts off slow with, say, a number like a 2 or a 3 out of 10, and eventually will start to get worse as the day or the weeks goes by, and then it'll be like 6 or 7 out of 10 pain or whatever it might be in your case. Third, when people have those conditions, it's usually because they picked up a new hobby or picked up a new activity, lower body activity. So for example, they might start running, they might started doing heavy squats or whatever it is, but it's usually based somewhere along the lines of you are training too much too soon, which will lead to that injury. So most people will be like, well, I don't really notice injuring myself, but then I've been starting to work out really hard for the last 2 months or whatever, and then before that I took like 6 months off or something like that. There will not be a direct trauma associated with it. Finally, these two conditions are mostly common in young adults, ranging from the age of 15 to 25, 30, and then it's not very common in older adults. I'm not trying to say that if you're older you can't get these conditions, but chance of having this condition as a younger individual is a lot higher than somebody that is over the age of, say, 50. Let's talk a little bit about the anatomy first, because this is the main way that you can differentiate if you have a runner's knee or jumper's knee. So first of all, this is going to be a left knee. So this is going to be a femur right here. This is going to be your patella, also known as the kneecap. Then this is going to be a tibia, and this the small fibula. Now we have the same thing on the right side. However, the blue tape right here represents the patellar tendon. This elevated portion is going to be your patella or the kneecap, and then this red one is going to be your quad muscle. Now, the quad muscle changes into quad tendon, attaches to the patella, and from the patella, the patellar tendon right here, the blue one, attaches to the shinbone or the tibia. Okay, and this is where the differentiation in the anatomy matters. If you have a runner's knee, then your pain is going to be on the kneecap right here. So it's either going to be on the kneecap, or it's going to be under the kneecap, or it's going to be right in front. That is if you have a runner's knee. If you have a jumper's knee, then the pain is going to be on the patellar tendon. So this tendon right here is going to be very sensitive to touch. That's how you know you have a runner's knee or jumper's knee. One more time, if you have a runner's knee, the pain is going to be around the patella. Sometimes it may even be under the patella, and you may feel this diffuse pain around the kneecap. And if you have a jumper's knee, the pain is going to be around patellar tendon, and just moving it and touching it, it's going to be painful. Second, jumper's knee is most commonly associated with individuals or athletes who participate in sports that require jumping, say basketball or even sprinting or heavy weightlifting. Runner's knee, on the other hand, just like again the name suggests, is more common between runners. People that have jumper's knee is going to have a lot more difficulty doing a full squats, but people with runner's knee will have much more difficulty going up and down the stairs. Especially going down the stairs is going to be much more painful than going up. Even though both of these knee conditions are because of overuse, how it happens is quite different. When it comes to your jumper's knee, your patellar tendon isn't able to handle the excessive load you placed on the tendon all of a sudden, okay? Which basically means that you weren't doing much and all of a sudden you went to Rocky Balboa and went all out, and your tendon isn't able to handle the load. The runner's knee, on the other hand, is a little different, and it primarily happens because of two reasons. And first, it's going to be because of your decreased muscle length in your quad muscle, and also because of the malalignment between your hip, femur, and your tibia. So if you consider your femur bone or the thigh bone as one track, and then your tibia as the other, and then the kneecap as the train, then your hip muscles on the side, especially the glute med and glute max, especially the glute med, aren't able to align the hip properly, and so there is a valgus force, so internal force, the knee going this way happens. Then the kneecap will start shifting this way, okay, and that's malalignment of the train or the patella is what causes the runner's knee. So when it comes to treating your runner's knee, the idea is pretty simple. Basically stretch your quad muscle and then make sure that your glute med is pretty strong so that it pulls the knee this way so that there is less pressure on the kneecap right here. When it comes to your patellar tendinopathy or your jumper's knee, the primary focus is going to be the eccentric motion. So really working on slowing down movement and coming up regularly. So things are kind of the same, but the focus is kind of different, if that makes any sense. But I'm going to go over the exercises. So like I said, for the runner's knee, what you want to do first of all is going to be stretch the knee, and just make sure that all this stretch is going to be in a pain-free zone. Okay, what you are going to do, you're going to hold on to the knee and you are just going to give a gentle stretch this way. You should be feeling nice stretch in your quads. You're going to hold, you can begin with about 15 seconds, but hopefully you can, increase your tolerance to 30 seconds or so. Again, you can vary the intensity. So if pulling this all the way up like this hurts, what you could do, I'm going to show you now with this angle. You can put it on top on something and just get the stretch in the knee, and sometimes that might be just enough. Okay. The second thing you want to do these exercises, you do need something like this. This is a hip circle from Mark Bell, but you can use TheraBand or something like that. Doesn't really matter. I really found this to be much more useful. Okay, but again, not endorsing the product, just a good one. What you're going to do, you're going to put this right over the knee. Okay, you're going to do some seated hip abduction. So what you're going to feel, you should be feeling, is right here on the side of the butt or glute med, and you are going to just do some pumping action right here. So you should be feeling on the side of the butt muscle. And if you are in a pretty inflammatory phase, or if you are hurting really bad, then I would recommend you sticking with this exercise. So define hurting really bad. So that's anything over 5 for our purposes. Okay, and obviously the intensity of band is going to be different, but you are going to just do that 10 to 15 repetition. And again, if the pain is over 5 out of 10, then I would just recommend you doing this twice a day, 10-15 repetition. You should be feeling a good burn. And now you're going to graduate from that and you're going to do some squats. Again, the band is kind of in the same side, and what you're going to do, you're going to push this out. Okay, push the knee out, focusing on that glute med, and you are just going to squat. Okay, and you should be feeling that muscle working really good. And now, after you were able to do this, say 10-15 times or so, there is no pain, what you're going to do is some side shuffle. Okay, the target is the same. What you don't want, and this is a very crucial exercise, so say for example, if my right knee is the injured side, then as I take a step like this with my left, I don't want this knee to cave in like this. Okay, so you have to be careful that your knee is tracking your second or the third toe, okay, as you do this exercise. Again, this is, first you can start off with the seated hip abduction, then squats, then you can progress to this one. Okay, so that would be for your runner's knee. Don't forget to do that stretch. Okay, so if I had to start, and if I had like a 5 or 6 out of 10 pain, I would do the quad set, and then I would do 1 or 2 sets of the seated hip abduction, and then I would progress based on my pain levels. Now, when it comes to your jumper's knee, the exercises are pretty similar. hey, you are going to do your squats, and I like doing them with this. But again, here is the focus, okay? So plus on both of these conditions, or any condition, you don't want to push through pain. You just want to touch the pain, and I don't want to get too specific in what degrees and this and that, and you know, you want to do 0 to 45 degrees or whatever. That's too complicated, right? I like making things simple. So if, for example, if going all the way over here hurts, then the simple answer is don't go up to that spot. What I would do at the beginning, again, just like the other time, push the band out, focus on slowly lowering down. From here, I would start to somewhere to neutral or 90 degrees, hold for a second or two, and up, okay? Push, hold for a second or two, and up. Go down slowly, slowly, slowly. So this is where the eccentric motion really matters. Once you're at the bottom, hold, up. Once you're able to do a double leg squat, so you can obviously, right, if this, even this is too painful, take the band out. You can just do the body weight. If you don't want to buy the band or don't have the band, and you can just do this, that's fine, right? Instead of 5 seconds, really focus on slow, going to 10 seconds or something, going down. Take 10 seconds to go down. But then you can progress, okay? And what I would do, I would get myself a stick or something. And so if this right leg is the injured side, for example, what I am going to do, I'm going to hold it with my left, okay? And I'm going to progress to a single leg sit to stand. And again, focus is going to be on slowly coming down. So I want to make sure I don't fall, right? So slowly sit, focus on the slow and control portion, and up, okay? Slow and control portion, and you can push the stick and up. Once I'm able to progress from that, I can do the same thing without the stick, okay? So what I'm going to do here, squeeze my butt, make sure, again, even on this one, the kneecap tracks the second or third toe, and then go down and up, okay? Slow, 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 and up, okay? Slow, 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 and up, and up. And then, once you're able to do that, what I would do is I would also now start working on the pistol squats, okay? So now I'm controlling the depth, okay? So what I'm going to do, slow on the way down, hold, up, okay? Slow on the way down, and up. And for the final time, I'm going to go very slowly, or try my best to go slowly. Slow, 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 and up. Okay, so these are your progressions. You are going to go from a double to a supported sit to stand. Then you're going to take the support out, and then you are going to do the sit to stand. And then you are going to go to regular pistol squats. And if these are too advanced for you, you can also do, right, if sit to stand, if the body weight squat is too easy, but the single leg, one leg is too hard, you can do something along the lines of this, wall sits. And you can obviously put a backpack, put some weights, whatever it is needed, and then you can progress your exercises that way. So when it comes down to treating and managing both of these conditions, it kind of comes down to progressive overload. So basically what it means is you don't want to go from being a couch potato for 2 years and then all of a sudden going Rocky Balboa in 2 weeks. So basically you have to start off slow, gradually build up the intensity, whether that is running or any kind of sports or weightlifting or anything it is. Try to make sure that you don't do too much. And Even with this condition, say you already have this knee pain, it's not like you want to completely stop your activity. Perform your regular activities, but just even that includes your sports or whatever, or weightlifting, but make sure you're doing it in a pain-free range. And also, if you really can't do anything, try to at least do some walking, because there are several studies that shows that walking is one of the best exercise that you could do to improve your overall pain, no matter where it is, if it's in the hand or it's in the knee or the ankle. So try to at least walk, or try your best to resume your daily life, your daily activities, your daily exercise regime, whatever it is, but make sure you do it in a pain-free range. Hopefully this video helped you figure out if you had runner's knee or jumper's knee, and you were able to pick up some exercises that you could do based on your tolerance. Hopefully it helped you reduce your pain and you were able to get back to the activities that you love. If it did, please make sure you click the like button. Please make sure you subscribe to my channel. More videos on physical therapy coming soon. Until then, take care. Bye-bye.